Next up, we have our information item with the superintendent update. Dr. Swift.
Thank you, Vice President Kelly and trustees, and those of you who've joined us in person and those who are joining remotely. We appreciate your participation this evening. The superintendent's update is really touching on some of our areas that we've been working hard to improve during this COVID fall opening. We've completed 6 weeks of school, and 6 weeks from yesterday, we'll bid our students and families a happy Thanksgiving and staff. So we are poised right in the middle of this fall section of the school year. It is truly wonderful to have our students and our staff back in schools. And yet, as several commenters have noted this evening, the long tail of this COVID pandemic is impacting our ability to have all of our functions and our operations going in exactly the way we were able to do in the before times. So I want to share an update, trustees. You're updated probably far more often than you want to be from me, but I wanted to share some of these updates publicly so that our community is aware as well. I was so delighted, as I know many were, to hear yesterday the president inform the governors to be prepared to vaccinate children in November. That was, I may frame that article because it was one of the most exciting news stories among many troubling news stories that we've had over the previous 18 months. The White House told governors to start preparing to vaccinate children as young as 5 by early next month in anticipation of the clearance of Pfizer's COVID vaccine for that group in the coming weeks. We were in with our partners from the Washtenaw County Health Department trustees on Friday, and I had another conversation today with the executive director. We understand that they are prepared. We are partnering with them to do some locations. We are hearing that pediatricians and drugstores and grocery stores, that the vaccine will be widely available. So that is truly great news. Secondly, we're delighted to understand that our staff will qualify for boosters under the occupational categories. So we're just thrilled that both additional vaccines available and boosters for our staff, both of these developments will keep our schools healthier and safe for our students and staff, for our families and community. As many commenters have noted, challenges continue during this fall of 2021, and it is important to openly acknowledge this reality. We're working hard and we're making progress. During this COVID fall, we have amended our action plans based on what we're learning every day and every week, and the COVID information changes and our operational information changes day by day as well. We are focused particularly on health and safety, always as our top priority, on hiring, staffing, and labor shortages, on resulting gaps that are occurring in our daily operations, and particularly in transportation functions. We have conducted 2 AAPS virtual job fairs. The second one was today. We are seeing those efforts be effective, and yet we continue with openings across our system. And I invite anyone and everyone out there who is called to this mission to serve children to check out our job openings. This is a great time. We will use this opportunity to improve and deepen the talent and the commitment on our team. We have made progress, trustees, as I think you're aware, with custodial and with food and nutrition. They are getting closer every day to being fully staffed. So we are closing the gap in those 2 areas. We do continue, despite recruitment and media attention and increased hourly rates, we continue to struggle to find before and after childcare workers. That is an area of continued struggle. Despite our best efforts, some operational processes are not at the high performance level we expect, we plan, and we work for in the AAPS. Again, I want to apologize for this situation and promise that we will continue to implement corrections every day. My team and all on our team are working long, hard days to try to get these areas corrected and mitigated. So let's talk about the current situation with transportation. Trustees, I've provided you a little bit of data this evening, just an update. We are currently transporting this fall about 3,750 general education students on a daily basis. That's our number at this time. We realize that that's down a little bit as a result of our shortage of drivers. We are also transporting about 134 students as a result of their special education IEP plans. Those are transported weekly, some are every day, depending on the program that they are enrolled in. Overall, folks may not realize it, but our buses travel a little over 6,000 miles a day, 6,065 miles per day. That is the equivalent of driving from Ann Arbor, Michigan to Anchorage, Alaska, and back each day as a part of making sure that our students get to school. There are 101 routes, so it's important to kind of quantify the challenge that we're facing right now. We are fortunate in comparison to many large districts across the country because our problem is not as pervasive. And I know that rings hollow for folks who are having the struggle. I do understand that. But at this time, we have 101 routes, and about 80% to 85% of those routes are running on time with their bus driver every day. There are, depending on the day, about 15 to 20 routes that will be impacted given the shortage of drivers. So at this time, we have 91 full-time drivers. Some of those folks, like most working individuals, have to miss work on some days or may have leave requirements, etc. But we have 91 full-time drivers employed. We have 13, they're called casual drivers. They support as substitute drivers. And the good news is, as a result of our aligning hourly pay, we now have among the top hourly pay in the region for our bus drivers. And I appreciate, trustees, your support in making those adjustments over the summer so that we could try to get this situation resolved. As a result of all the efforts, we have about 18 drivers in training. 6 of those came in with CDL licenses already. That's always exciting because that CDL process is a several-week process from hire to training to licensing. So we know that staffing up this team is a process. We have enough folks there to resolve the issue, and yet there is no cushion. We are headed into winter, and realistically, this is a problem, trustees, that will be several more weeks as we see our progress to resolve it. So here are the steps that we are taking given the reality that we are facing. As you know, we've aligned the compensation, the benefit packages. We are also working with 3 strategies on a daily and weekly basis. Strategy number 1 is pretty simple: combining routes. I have here with me tonight Ms. Liz Margolis, who works closely with our general manager, Ed Gallagher from Durham. And what they've done is to combine those routes that will go together. And those students are on combined routes, meaning the driver gets all of the regular students and then gets a portion of another route. Those routes will run, as you heard from some of our commenters, they may run 15, 20, 30 minutes late. But the good news is every child who needs it will have that transportation. We are working to provide families with consistent communication, and we've switched this to communicate in advance. So Ms. Liz Margolis, Mr. Andrew Cluley, who's over on this side tonight, will get those emails out the night before, and we're getting to the point of stabilizing where we can put it out perhaps on a Friday for the following week. We want our parents to know ahead of time so that if they are able, and we recognize not everyone is able to do so, but if they are able, we want them to have the opportunity to make other arrangements. I have heard from lots of families who are carpooling with a neighbor, they're making other arrangements. And then we also know there are lots of folks who are not able to do that. Our principals are working closely with families so that if a child is supposed to have breakfast, if they're arriving late, they're still going to have that free breakfast, and we'll get them into class as quickly as possible. As drivers come online for duty, among those 18 drivers, these routes will be staffed as we get our drivers in. Families are reminded weekly of what to expect on the combined routes. The second strategy we are using is that on a daily basis, there will be some routes that are not covered through combined. So those routes have to be stacked, which is more challenging because it means the driver runs this full route, then goes and runs a second full route. Those routes end up being delayed, as we heard this evening, around an hour, or even it could be a little bit longer. We only use that stacking when, when there are morning call-offs and when there are emergencies. We make every attempt to avoid that. But barring an emergency, those calls are made. They may not be made until the morning of, if those call-offs happen in the morning. So these daily unanticipated route changes, and I do understand that they're a terrible burden on families, and yet they are unavoidable. We don't have the cushion for substitutes quite at this time. So we will make folks aware, Mr. Cluley, it's every morning 6:30 to 7:30. We receive that update from Ms. Margolis. Mr. Cluley puts out the calls so that our families are notified. We also notify the principals so that they and the teachers are aware. I just want to thank everyone for their extra support out there. It is so inspiring to hear about families working together and helping each other out, walking or driving groups of students. I appreciate the parents who've dropped by the transportation office to give treats to the bus drivers. I just want to give a shout out to our AAPS Durham team drivers, to Ms. Margolis, Mr. Cluley, the drivers, the leaders, and I want to give a special spotlight tonight to Ed Gallagher, our AAPS Durham General Manager, whom I know is working early and late every day for these 7 weeks. I would ask that when you interact with a bus driver or a monitor or a supporter, that you remember that these drivers are working extra duty, and they're showing up every day, and we appreciate their work. We want to get more colleagues for them so that this situation can abate. Trustees, the second half of the superintendent's update is on our COVID health and safety. As you all know, we work every day and continue to hold the health and safety of our students and staff, families, and community as our highest priority. Our students and school teams, trustees, they are doing a beautiful job of following the COVID mitigation steps. I am around schools when I can be, and they are outdoors as much as they can be. They are wearing their mask when indoors. It is inspiring to see how committed our students are, and even young children, if I talk to them about wearing their mask, they can tell you that they're doing that to protect others. And it's so inspiring. Our nurse team, and a shout out to Miss Jenna Bacalor, the nurse and health specialist team. They are doing case management, identification, contact tracing, day and night, Saturday and Sunday. I get reports multiple times a day, 7 days a week, and this has gone on throughout this time, and as well as last spring. We are consistently each day working with Washtenaw County Health Department. We appreciate the work of Ruth Kraut and Susan Cerniglia and all of the team in supporting the work that has to go on in our district to keep our students healthy and safe. Jimena Loveluck and Dr. Marquez were the other two names I should have said there. We do continue to see high COVID transmission in Ann Arbor and continue to experience increased COVID-19 cases across our district. Unfortunately, we have observed evidence of in-school transmission in some locations. Most of our district cases are occurring spread out across our schools. One or two here, one or two there. We expect to see that. And yet, trustees, as you're aware, in about 3 locations over the previous 10 days, we have seen a very different, higher level of cases. And that is a concern. As an update on Pittsfield, we've shared this out with the community. The Washtenaw County Health Department has determined that some cases in that uptick did represent a school outbreak. And as you are aware, trustees, this week at Burns Park, we have experienced approximately 24 student cases in the few days since last Friday morning, as well as staff cases. Today, our nurse team and health specialist team did a pop-up testing for families and students at Burns Park. They did about 75 tests over there today, and additional cases were confirmed during that event. We are also waiting for about 5 sibling cases that are currently pending. This sudden acceleration of cases is a concern, and the investigation is underway with Washtenaw County Health Department. We remain in communication every day with that team. It is more important than ever that our students and our staff remain home when experiencing any COVID symptoms. In the cases we are seeing, vaccinated students and staff continue to be far less impacted by illness. It is clear that our high levels of vaccination in the Ann Arbor Public Schools provide substantial protection. We appreciate all who've been vaccinated and continue to strongly urge all to get their vaccination and get their booster. Trustees, I did have an update today. I haven't had a chance to send it to you, that we have moved on our AAPS team from 94% to 95% fully vaccinated. I do not know of another district with that high of a vaccination rate, and I just want to give my deepest gratitude to our staff, to our teachers, for doing that to protect all of us in the schools. I know that everyone knows by heart the public health guidance. Any of us could say it, but it is time. I'm asking for help from our parents, that the concern with our students in COVID, preschool and elementary, middle schools and K-8 campuses through 6th grade, our locations are inhabited by individuals who must remain unvaccinated at this time. So I'm reaching out to parents today and sharing that we need your help. We're so very close to pediatric vaccines, and yet we are also at the change of the season, the fall holidays. Halloween is just a few days away, the coming of colder weather and moving indoors, and our children under 12 years of age are at increased risk. So we will continue to hold health and safety as our top priority. We will continue to work every day on the operational challenges that are forming this kind of long and stubborn tail of our COVID impact. We want to hold on to this strong school opening. We just ask that everyone please reconsider gatherings that you have coming up. If they can be moved outdoors, be sure to wear your mask while indoors. And I just want to share special gratitude to everyone on the Ann Arbor Public Schools team. Our teachers and staff, I'm sorry, Anna. Our leaders, everywhere I look in the district, people are working hard. They're digging deep. They're sacrificing time with their own families so that we can have our schools open, so that our children can be happy and learning in school. And I just want to share my gratitude. I know the board feels the same way. This is a calling, it's a mission, and our team is stepping up. I want to thank our parents, our community members who email me and say, what can I do to help? How can we help with this opening? It's our own actions and steps that keep this opening going and that demonstrate our caring commitment to our children, to each other, and to our community. So I thank you, trustees, for the opportunity to share. This is the draft of the message that will go out this week to the community. We'll tighten up some of the details. I wanted to get your input and feedback this evening before sharing it with the community. Thank you.
Thank you, Dr. Swift.